of life. On this webinar in particular, it's giving me so much of happiness to see Gunjan, Dr. Gunjan here. It's a very special webinar for us to have Dr. Gunjan and Sarthi Ajita here.
Attention, we are conducting our webinar today on cancer. Um, I would like to welcome our guest of honor today, Dr. Gunjan Baijal, who is a senior oncologist at Manipal Hospital-Goa.
Thank you so much. Thank you. Thank you. Thank you for the welcome. I'm very happy to be on this platform.
Thank you. Thank you. And for the sake of convenience, again, let me repeat that I'll be asking Doc a few questions. However, the floor will be open for all of you at the end of my short question and answer session. So hang in there. And if you have questions that are not answered during the webinar. Doc, thank you once again for taking time off from your busy schedule. Across the world, people are living longer. The life expectancy rate has almost doubled in the last 60 years. So in this scenario, what can we senior citizens do to ensure our good health and well-being? Any thoughts on this?
Yeah. So let me first start by saying that you see, as per the old adage, whenever we meet people, so nowadays there's a fad of saying there is bad food, bad this, bad all around us. Our ancient people were living much longer. But if you, as you say, if you really look at the statistics, then we have a longer lifespan now than in the old age. So that is a myth that is there, which has been busted by your own statistics. Why is this happening? See, you need to understand why is our health being so different now. We are living longer. So this is because, say, if you compare independent India with 1947, life expectancy was close to around 37, 40 years. Now we are around 70. So at that point in time, all over the world, there was a scourge of the infectious diseases. Antibiotics were not well developed, and we were having a problem with these infectious diseases. So people were dying very young. But slowly, with the advent of antibiotics, the discovery of penicillin, and so many other drug substances, we started conquering these particular diseases to a very, very, good extent. And as a result of that, we started living longer because there were no more infectious diseases to kill us at that particular age. Now, obviously, man is not immortal. So at some point in time, life is going to come to an end. And the rest of it, whether it will come to the end at 70, 80, 90, that is all our own imagination that we have. It doesn't work that way. So the idea is to live as long as possible, and at the same time be focused that our health is in such a condition that we are able to manage ourselves, do our things comfortably. And that is where this concept comes, because as you age, chronic diseases will set in. You will get some kind of chronic diseases which will cause problems for you, but in spite of that, if you keep your focus right, if you follow a good healthy lifestyle, which we will be talking about as we go along, I am sure this long longevity that we've achieved is going to be productive and good, rather than bedridden kind of a situation.
Okay. Thank you, Doc. So basically, we have to look after our health and keep a check, which means that we have to have regular checkups.
Yes.
And, and not be frightened of that monster called doctor. Because what I find among senior citizens is a reluctance to go and meet a doctor or even visit a hospital. What they feel is, aging is a natural process and one has to just take it with a large pinch of salt. So how do you motivate senior citizens to, go in for regular checkups, and why is it important to have regular checkups?
An apple a day keeps the doctor away is what people say. You can try it. It hasn't really worked. It's still a saying. So again, why do you need to go to a doctor? See, infectious disease is a acute condition. So suddenly it happens, you get the infectious disease, you go to a doctor, take a medicine, and you get all right. But once you're beyond that spectrum of infectious diseases into the 40s and the 50s, what is going to set in are chronic diseases. Now, what is the difference between this acute and chronic? Acute happens suddenly, gets all right also suddenly. Chronic disease is a chronic process in the body that keeps on happening over a period of time, months, years altogether, and keeps, modifying your bodily activities. So for example, a good simple example of a chronic disease is diabetes. Why should you be bothered if your sugar is 400 or 200 or 500 or 90? Or why should you be bothered if your blood pressure is 140, 180? It's not causing you any problems. So why should you bother at all? The reason is because when these conditions keep on occurring in the body for a long period of time, these are going to destroy the other organs by virtue of their, bad effects. So when that end organ damage, or say diabetes can destroy the kidneys, it can cause affliction of the eyes, it can cause affliction of the heart, the nerves. Similarly, hypertension can also cause affliction in all these organs. Once that affliction starts, that becomes irreversible, and that is going to cause a deterioration in your health parameters and your functionality. It is not the idea that you should hypertension and diabetes in check so that you can avoid these end organ damages. And that is why you need to check, because it is always better to have these things diagnosed and nipped in the bud before this end organ damage starts. And that is why you need to go to your doctor and get yourself regularly checked. And similarly with cancer also, cancer is also a chronic disease. It doesn't happen overnight, and it doesn't kill the person overnight as well. It starts from a very, very asymptomatic manifestation of a small tumor which is not going to cause any problems, and then develops into something which is, bombastic, and you cannot salvage the situation from there. So similarly for cancer, there is no need of fearing. You just need to check it up regularly. For example, a lung tumor develops in a lung. Your full lung has got a capacity of 5 liters. Out of that, you are using on a day-to-day basis, on a regular inspiration expiration cycle, 500 ml of that 5 liters. Now, if you have a tumor which takes away 200 ml of that space, will you feel any difference? You can't feel any difference, because you've got 5 liters of capacity and you want to use only 500 ml. But when this 200 ml of space enlarges and starts taking up a liter, 2 liters, 3 liters of space, then obviously you will start to feel the discomfort. So when that has happened, means the disease has spread to various different places. That is why regularly checking it up will probably catch it in that small 200 ml space, where you will be able to take quick treatment, short treatments, and more efficacious treatment, which will add on much more quality of life and much more life or days and years to your life. That is why it is always important to get yourself checked. Beyond this, if you want motivation to go to the doctor, I don't know what else will motivate
Yeah,
you from the fact that to stay healthy and disease free for a longer period of time.
you put it very well, doctor. It is a wake up call for all of us to, ensure that we schedule our regular visit to the doctor. Yeah, that is indeed an eye opener. And, you know, does one's life, you did mention that regular checkup is required, but beyond that, does one's lifestyle and life choices make a difference to our health and well being, and also our mental well being, probably?
Oh, yes, definitely. Lifestyle choices are definitely very important for any person. And these lifestyle choices should not occur at the age of 50 years. They have to start at a very young age. For example, people who start smoking young develop cancer in their old age. So that lifestyle choice has to start at the very young age. Tobacco avoidance and cessation has to start at a very young age. Women, especially in the modern day setting, a lot of women are now, I mean, there is a lot of development of promiscuity compared to old earlier years. That is what is leading to cervical cancer surges, and now we are trying to combat that with vaccination. So having a vaccination program at the age of 50 is not going to help you.